Good day, and welcome to today's Staffing Challenges and Solutions Insights from the Frontline webinar. Please note, this webinar is being recorded. All participants are in a listen-only mode. If you would like to ask a question, please enter it into the Q&A panel located at the bottom of your screen. You may also ask a verbal question by using the raised hand feature also located at the bottom of your screen. It is now my pleasure to turn the call over to Lisa Sullivan. Please go ahead.
Thank you. Next slide, please. Good afternoon. My name is Lisa Sullivan, and on behalf of the Centers for Medicare and Medicaid Services, we are very pleased to have you joining us today for a national LAN event. Today's National Learning and Action Network event is entitled Staffing Challenges and Solutions, Insights from the Frontline. The Learning and Action Network is a group of healthcare professionals and stakeholder organizations convened by the QIO, the Quality Improvement Organization, which come together to improve patient care or population health and spread best practices through peer-to-peer learning and solution sharing. Stakeholders can partner with the QUIN QIO to participate by joining the LAN. A few reminders before we get started. Today's slide presentation is available on the QIO program website, and that's qioprogram.org, and it's in the chat box. And the recording will be posted there in the coming weeks, so please be on the lookout. Next slide, please. Today, we will hear presentations focusing on successful solutions to staffing challenges during the current public health emergency. We will hear from the Vice President of Operations, Matt Murray, from the Orchard Senior Living Campus, in addition to Denise Wolbert, the Director of Quality Performance of Baptist Home Society. Denise will share tips to engage and retain staff, including details about the Crisis Employee Support Program, CRESP, a partnership of Baptist Home Society is establishing with the Healthcare Council of Western Pennsylvania that helps staff with social determinants such as food issues, finance, and housing challenges. Matt will share how the Orchards is utilizing the 1135 waiver and how it relates to CNA education and training, in addition to sharing tips to identify and operationalize a basic framework to set a temporary CNA up for success in a real-life and real-time assignment. We would like to thank both our presenters for taking the time to be with us today and sharing their stories with you. Next slide, please. Our presenters for this event were secured by Quality Insights, the QUIN QIO for Pennsylvania and West Virginia, and their program director, Biddy Smith. We would like to offer a big thank you to Biddy for her contributions to this national LAN. Biddy graduated from West Virginia University in 1996 with a bachelor's degree in nursing. Over the next 24 years, she has gained a variety of experience from intensive care, managed care, wound care, sales, and currently quality improvement. In 2018, she graduated from Capella University with a Master of Science degree in Nursing Informatics and also completed a Master's Certificate in Healthcare Administration. She currently is Quality Insights QUIN QIO Program Director. Biddy will introduce our presenters for the day, and Biddy, the virtual floor is now yours.
Thank you, Lisa. Quality Insights is pleased to be able to provide the speakers for today's call. Both bring a variety of experiences and innovations to meeting staffing challenges. First up will be Denise Wolbert. Denise and Quality Insights share a long history of working together to improve the quality of care for Pennsylvania's nursing home residents. She's been a true partner, sharing best practices and helping to problem solve in the true spirit of collaboration. Her expertise as a leader and advocacy for those most in need is evident in all she undertakes. Here is Denise's bio. Ms. Wolbert is a graduate of St. Margaret's School of Nursing and then earned her BSN degree at Waynesburg University. Denise has been in long-term care since 1990, having worked in various positions as staff development, Assistant Director of Nursing, Pharmacy Nurse Consultant, and Personal Care Home Administrator. She taught CNA and pharmacy tech training at Scioto County Career and Technical School and Shawnee State University. Currently working for Baptist Home Societies as the Director of Quality Performance, supporting the leadership team in quality assurance performance improvement initiatives, regulatory compliance, education, best practices, standards of care, and is involved in the development of a corporate culture which provides person-centered care to the residents served. Denise assisted in development of the customer service program and implemented the program organization-wide. She works with the society communities to develop processes and initiatives that enhance and improve resident quality of life, and she is an active participant in the development of new policies and processes in managing the risk related to COVID-19. Our second speaker will be Matt Murray. Like Denise, Matt has always been willing to collaborate with Quality Insights. His passion for his residents and the care they receive make him a valuable partner. His devotion for his work makes him a powerful advocate for our nursing home task. Here's Matt's bio. Matt is Vice President of Operations for the Orchards, post-acute and long-term care. Matt develops and implements policies and procedures to comply with federal, state, and local requirements and to fulfill licensure certification standards while maximizing revenue and profit. Matt has served in roles such as nursing home administrator, assisted living administrator, and compliance officer prior to his current role. Matt embraces the Orchard's mission, which is we care for minds, bodies, and souls. He assures that the care and services provided meet or exceed the expectations of the residents, their families, and physicians, thus minimizing complaints, licensure violations, and lawsuits. Matt is licensed to practice nursing home administration in Ohio, Pennsylvania, and West Virginia. He has been recognized by American College of Health Administrators as a certified nursing home administrator and a certified assisted living administrator. In addition, through the state of Pennsylvania, Matt is licensed as a personal care home administrator. Matt attended Glen Oak High School and West Liberty University. He graduated summa cum laude and first in his class in the university's College of Business. Matt is active in the industry and community through board directorship with West Virginia chapter of American College of Healthcare Administrators, John D. Rockefeller IV Career Center Health Careers Advisory Board, the Southern Columbian County Region Chamber of Commerce, Brooke Hancock Family Resource Network, and Oakland Junior Bears baseball and softball. Matt and his wife Haley Ann reside in Chester with their daughters Madison and Macy Jo and their son Max. Thank you both for being here with us today. Denise, you may begin.
Thank you so much, Biddy. You know, I was thinking, wouldn't it be great if all of us on the call right now could be together in one big room, 6 feet apart, of course, and masks on, but really could pick each other's brain and really brainstorm. You know, no one has all the solutions, but everyone has some, and it would just be great to be able to share all that with you. Next slide, please. So let me just tell you a little bit about Baptist Home Society. I'm very proud to work at Baptist Home Society. As of today, both of our communities are 5-star, and what I'd like to brag about is that they're 5-star in quality measures. So it shows the commitment our staff has to the quality of care for our residents. Both of the communities are, depending on which one you're on, are 6 to 8 miles from downtown Pittsburgh, Pennsylvania, home of the Steelers and Penguins. Go team. But anyway, I had to put that plug in. But we service all levels of care, independent living, skilled nursing, personal care, or what other states call assisted living, HUD housing, and all financial aspects of care as well, private pay, Medicare, Medicaid, and benevolent care. And so it is a community that is technically suburbs, but not very far from the inner city. Next slide, please. Baptist Home Society is in Allegheny County, a county that has a population of about 1.2 million people. So you would think with that many residents in Allegheny County and being near other large counties, Beaver, Butler, and being in the tri-state area of Pennsylvania, West Virginia, and Ohio, that we would not have any staffing challenges. But within our county alone, we have 61 skilled nursing communities, 130 personal care or assisted living facilities. Within a 25-mile radius of where we're located, there are 21 hospitals, acute care, children's hospitals, acute psychiatric, rehab. So we also have multiple home health, home care, and hospice agencies. Last week, one of our residents was placed on hospice, and the family chose a hospice we had never heard of before. So that's how many different hospices are available. So with all of those healthcare organizations and the surrounding counties and states needing healthcare, we were challenged prior to COVID. Everybody is pulling from the same pool of staff who choose to work in healthcare. We're a nonprofit organization, but our wages are pretty competitive. Maybe not quite as good as for-profit, but still pretty competitive. But then on every corner, there's a Walmart, a Target, a big box store, fast food stores, fast food chains, grocery stores, all looking for employees. And their wages are pretty competitive with what we're making. And so when you have someone who prefers not to be in healthcare, would rather lift a box such as Amazon, which is in the area, as opposed to taking care of people, it's very difficult to find staff. Next slide, please. At 2 o'clock on March the 14th, 2 o'clock in the morning, I was on the CMS site, the survey and memo site, or the policy and memo site, looking for the newest CMS guidelines. So on March 14th, just like you, we closed our doors to visitors, stopped communal dining and group activities. That following Monday, Pennsylvania Governor Wolf started closing down non-essential businesses. So schools closed, daycares closed, restaurants, bars closed, anything that was not considered essential closed. So our staff was greatly impacted by that. The bus and the transit system closed down. Once it opened up again, the routes were limited and the number of people that were allowed on the bus were limited. We have some staff that take 3 buses to get to work. Just like yours, I'm sure our staff were afraid of getting COVID. Within the first 2 weeks, we lost 20 staff, high school and college students, primarily because their parents said, I don't want my child working in that environment because they could get COVID. Now, the majority of these students were in our dining services, but we still had to make meals and serve meals to our residents. Our staff had at-risk family members, and because of schools and daycare being closed, there were child care issues. So to make sure that we had the correct amount of staff to care for our residents, we started using agency. Prior to that, we didn't use a whole lot of agency. The agency was a blessing, but also a burden. Of course, you know that there are those good agency employees, but those agency staff that you asked not to come back. But they would go onto our units and they would tell our staff how much that they were making and the flexible shifts that they could pick. And if they didn't want to go to work, they just didn't go to work because they could always find a job. Our unemployment claims went up 800% at one point because a lot of people who leave healthcare don't stay in healthcare. And so if they were in a non-essential job, they didn't have a job, and so we were responsible for those unemployment claims. Then with unemployment being 26 weeks and the additional 13-week and then the $600 supplement, and then in Pennsylvania when the $600 supplement stopped, we had a $300 supplement. People were just not incentivized to go back to work. So unemployment in Pennsylvania was skyrocketing, and everywhere healthcare communities had hiring signs out. On top of that, what made it a challenge is that the media portrayed us as places you didn't want to work. We, if you came to work at a skilled nursing community, you were going to get COVID, you could die, you could take it home to your family. One of the nursing communities in the county right next to us was on the national news because of the number of positive cases and unfortunately the number of the residents that died as a result of COVID. So all of these were challenges already on the challenges we were facing. Now we had these additional challenges because of COVID. Next slide, please. So we tried to look at what could we do to entice people to come to us to at least walk in the door. So we still do mailing ads. We do ads with pictures of staff and residents with smiling eyes and masks on to show that we still provide the care and it's still a good place. And we try to look at the things that we do positively. We definitely do social media, Facebook and LinkedIn and Instagram, you name it, we do it. And we encourage our staff that are on those sites to share our ads with those individuals that they're linked to. We looked at technology, we looked at digital marketing, we looked at geofencing, where if somebody clicks on one of our ads, it kind of follows them and whoever they're in touch with. We looked at whatever time was available, we'll interview you. You can come in PPE and we'll interview you, or you can do a virtual interview. So we try to be creative. We are actually paying people to come in for an interview. You're not even hiring them, but just giving them a $10 gift card just to come in and interview. Because I'm sure you also encounter, somebody says they will show up and they never do. We gave our employees all types of incentives to refer staff. We offered, and we did get several new hires as a result, free health care for a year. It's not our upper tier level of health care, but it's still a good tier with minimal out-of-pocket expenses. Of course, tuition assistance, sign-on, gifts, it's Baptist Home Society gear, but it's still a gift that you give when you come in. We have a very good 403B that our company participates in, and other benefits where local businesses give you percentage off as long as you show your ID badge, so that you get 10% off haircuts and grocery stores and scrubs and all those good things. We allow the new employees too to schedule their physical, their TB, COVID tests. We do test staff before they start, so at least we have a window where we know that they're COVID-free before they walk in the door. Our orientation is 2 times a month, but we even allow them if they can't make that, so that we don't lose them and they don't lose any pay. We allow them to start in between, just making sure they have the appropriate education, fire safety, resident rights, resident abuse, before they actually start their job and are having any contact with residents. But we knew that, as much as we were working, that we weren't getting a lot of applicants. So we still work very hard. Our HR department, led by Mr. Conti, does a fabulous job in trying to recruit people, but we knew we had to focus on our existing staff. We could not lose the staff that we had. Next slide, please. So we wanted to look at some of the things that we could do. Of course, money is, whenever you ask anybody, what can we do to make sure you stay here, they always say money. And we know that can be a challenge for some of us. So, but we do review our salaries at least twice a year, and more so now that we've been looking at that. But we did look at some incentives that we could give the staff. So if the staff would pick up an extra 4 hours, we gave them an additional bonus, per hour bonus. If they picked up 8, we gave them additional for the 8 hours. Double referral bonuses, which is PTO for changing status. So if they go from PRN to full-time or part-time to full-time, we give them PTO bonuses. Now, paid time off can be used for vacations or anything that they choose to, but they can pay them back. And then incentives for the red zone, flexible schedules so that we can work around their needs because of children and daycare. PPE and testing, that put a breath of fresh air into the communities once they knew that PPE and testing was available. And Take a Healthy Step is a way to reduce their health insurance premium by getting involved in healthy activities. Next slide, please. Communication was the key that we thought. I never thanked anybody for coming to work. That's part of your job, is coming to work. But now I do, because people don't show up. People call off. People don't come in. So we're thanking people. Town halls is where the CEO, Mr. Allison, and the HR director and the executive directors, they come together, and it's a State of the Union. What's going on? Fireside chats is where the director of nursing meets every Friday, twice during the day, for any department to come in and ask questions. One-on-one are the most critical. Staff needs their fears validated. They needed to know that we understood that they were afraid. They were still coming to work, but they were afraid. We looked at communication at change of shift. Everybody knows who their key staff is. Who are those staff members in your building that really can change the flow of how things go. So making sure that they're in the know what's going on with what's happening with COVID. Stay interviews are 6 months after their annual interview. It's a sit down with the employee. It has no money involved whatsoever. It's just a one-on-one with their supervisor. How are things going? What do you need? How can we help you grow as an individual? And just are you planning on staying with us? If no, why? If yes, why? What can we do better? COVID updates every day, making sure they knew any changes and changes of processes. We had staff get very upset with us because we were very fortunate early on when we had somebody positive, we would bring them out of isolation by 2 negative tests 24 hours apart. Well, we changed that when it became the symptom-based strategy, and we didn't mention that to the frontline staff. And so when they saw people coming back in 10 days instead of 30 or 40 days, they were upset. So it's so important to make sure that they're aware of those changes. Also, we used the 1135 waiver to move residents out of their rooms so that we could develop yellow and red zones. And it was very important that we explained that whole process to the staff because they were they wanted to make sure the resident was well taken care of. Next slide, please. So the other things we did is we focused on the development of the staff, the LEAD program, where we picked out top staff and made sure that they were they were leading, they were educating. Each department was charged to develop a specific retention engagement plan for their department, how to keep staff. Special events. We had an administrator that dressed up like a cow and handed out utterly smooth hand cream for utterly fantastic staff. And then we got involved with customer tips, culture change, making sure we, made COVID part of the new culture now with masks and hand washing and social distancing. We reviewed the day-to-day process to try to get as back to normal as possible, but still maintaining COVID changes, and then looking at the new onboarding. Next slide, please. Finally, what we needed to do is we needed to focus on the employee wellness. They had so many fears and concerns, and they were so stressed coming to work because what was going on in their personal life and then what was happening with COVID on the front end. So they were burning out. They're working extra shifts, extra days, double shifts. So our director of wellness, Fabiana, really looked at programs that we could provide for them. The gym was kept open so they could still exercise and burn off some of that stress. Our employee life assistance program, we have YouTube videos for exercise, free online therapy programs. In fact, when our paychecks go out this week, there's a list of resources for them. Next page, please. Next slide, please. So one of the things that our CEO, Mr. Allison, thought of, was concerned about was the social determinants that our staff face. We have staff that have asked us if they could have the food that was left over from our residents, the food that wasn't eaten, because they weren't sure if they had money to buy food until their next paycheck. We have staff that had to move because they had rats in their house and they were looking for housing that they could afford. So in working with our faith-based organization, got together those CEOs, and they're working as part of Healthcare Council of Western Pennsylvania. They applied for a grant from the Richard King Mellon Foundation. AJ and Judy and Hillary and Pat at Healthcare Council wrote this great proposal, and it was accepted out of 235 proposals. And it allows the staff to privately apply for these food boxes and financial support and emotional health support. It's just starting. We're just getting it underway, but we have several staff that are already participating in getting all of those food boxes. Boxed and canned stuff, dairy, milk, you name it. And so it's food that they may not have for them and their family. There will be financial support, helping them maybe improve their credit score, learning how to create a budget, managing their debt. And so that's very important to them so that they can maybe get out of debt and manage the money that they receive a little bit better, particularly now where some of them are two-income families and one of the individuals in the home is not working. And then emotional and mental health support. It's all very private, all very individualized for them, and what's the best clinical practices for them. So this CREST program was developed between the CEOs and the Healthcare Council of Western Pennsylvania, and we're very pleased to be part of that group. And so they're working on developing it and even improving the program. Next slide, please. I just wanted to mention that if you have not reached out to your state and your regional organizations, please do too. I can't even mention, tell you how important these agencies have been for us. Quality Insights with Biddy and Patty Austin and all of those agencies were able to reach out and ask questions. And also the Regional Response Health Collaboration, if we would become in a dire situation, they would help us get staffing if we were really in dire needs. Next slide, please. I just want to finish off by saying, I know how important our frontline staff is, but we really need to take a look at our leadership team. It's so critical that we realize what they deal with on a day-to-day basis, as well as the infection control staff. I belong to a Facebook group that's infection control, and I can't tell you how often somebody says, I'm done, I'm finished, I can't do this anymore, I'm getting out. So, with everything that the leadership team faces on a normal day-to-day, and you compound that with COVID, we need to make sure the leadership team is taking care of themselves and their well-being, because if we don't have good leadership, then we're not going to be able to function as an organization. So lastly, thank you for coming to work every day. The easy way is to not be in skilled nursing, is just to go find something else to do or go on unemployment. But you come to work every day and you make sure that the care and services our residents deserve, they receive. So thank you very much for what you do every day. And so I apologize for going over, Matt, but I'm going to turn this over to Matt, who can't wait to hear about. He's using the 1135 waiver and the temporary nurse aid program, and so I'm very anxious to hear about that. Thanks, Matt. It's all yours.
Thanks, Denise. No problem. And anybody can just, kind of prod me along, because I got a tendency to get off on a tangent and long-winded. But Denise, that was great stuff. I can say that you have a truly beautiful facility, the one that I've been able to actually visit in the past. So it looks like you guys are doing a lot of really terrific things. So, guys, to get rolling, as everybody knows, there were a number of waivers that CMS had granted at the onset of the public health emergency. And these waivers, while you don't always see a ton of these during a public health emergency, is an opportune time for many of those regulations to have the ability to kind of have a red line temporarily drawn through them to allow facilities and providers to focus on taking care of people versus having to ensure that T's are crossed and I's are dotted. It doesn't mean that we can't care for the people that we have underneath our roof and within our care, but I can say the good faith effort that CMS has made to waive many of the burdensome regulations during such a critical time has been much appreciated by providers, especially our facilities. Next slide, please. So the particular waiver that we're going to focus on here is related to the Certified Nursing Assistant Education and Training. We're going to go through that waiver. It's a little bit of a lengthy one, but we want to just take a quick read of it and be able to ensure that we know what is waived and what isn't waived as part of that particular waiver. And then to identify and operationalize, a framework that we can set up somebody that hasn't gone through the Certified Nursing Assistant course, the formal one, so that they can be successful in a real life and real time assignment. Next slide, please. So the waiver that we're going to focus on is the one that's at 42 CFR 48335D. That's the one that requires skilled nursing facilities to not employ anyone longer than 4 months unless they have met training and certification requirements. So CMS had waived this for that purpose of trying to avoid the potential staffing shortages from COVID-19. We'll talk a little later on, but workforce was a major challenge for our industry prior to the public health emergency. So I especially appreciate the fact that CMS noticed this right at the onset of the public health emergency and put a waiver in place to allow providers to be able to bring folks in and train them up. We're going to talk a little further about that down the line. Next slide, please. So to ensure the health and safety of nursing home residents, CMS is not waiving 48335D1I. So what that entails is it still requires facilities to not use an individual working as a nurse aide for more than 4 months on a full-time basis, unless that individual is competent to provide nursing and nursing-related services. So essentially what CMS is waiving here, they are allowing that the portion of the course that is quote unquote book related, that is kind of being condensed into an 8-hour course. If you're a member of the American Healthcare Association or another type of association that works with our industry, then there may have been a temporary course that you've seen that you can take. And I know that the American Healthcare Association course has been a very solid one. We've used that as the framework of our program. But the big thing here is they're waiving that book piece, but think of it as the clinical piece and the competency piece is really going to be kind of emphasized during this time. So we have to make sure that those individuals that we're bringing in to care for people are still competent in all those areas that a care plan covers. Next slide, please. Further on this, so anything that would be described in the plan of care, those are the areas that we truly have to make sure that these individuals are competent. So if somebody needs assistance with, bathing or transferring or toileting, any of those areas that folks often wind up in a skilled nursing facility or a nursing facility, we can't just say, okay, you sat through a course, now you're ready to go. We have to truly make sure that there's a framework in place to make sure that not only what they took in during that 8-hour course has hit home, but to ensure that they're competent in the actual skills and have the abilities to do those skills in the practical world of a care plan. Next slide, please. So some real life problems before we get into how this program has actually been used as our own case study. Anybody that's a provider has probably seen over the last decade plus a lack of qualified candidates for their open positions. Folks that are applying for certified nursing assistant positions, they're generally already employed, right? There's a tremendous shortage of these individuals. And good ones are typically already employed by somebody. Another major hurdle, if you don't have a lot of space in your facility, creating your own CNA training program requires significant space. You have to have a lab set up, you have to have the classroom space, and there's a lot of time and monetary resources that have to be dedicated to that in order to meet the current regulations. Length of time to onboard individuals. Background checks, physicals, drug screens if you do them, the pre-employment paperwork. I've had many individuals tell me it doesn't matter if they were applying for a housekeeping position in one of our facilities or an administrator position. Man, there is a lot of work to be able to go to work. Many have asked when they get their FBI clearance after going through our pre-employment process. And that's all to check those boxes to make sure that we're putting people in a position to successfully care for others. Another major hurdle that we have to overcome, CNA turnover ranges anywhere from 60 to 80% nationally, depending on the source you're looking at. So these are positions that turn over very frequently. It's often the most turned over position in any individual facility or for any individual company. And lastly, wages and benefits over the last dozen years have, really compressed, and they're very comparable these days to retail or fast food or factory work or fulfillment centers, much like you heard Denise speak of. And many of these positions are less physical, and there isn't the same psychosocial demands and stress. It's a very, very taxing position, the most challenging position in our facilities. Next slide, please. So the real life case study, here at the Orchards, in all of our skilled nursing facilities, we began utilizing this program as soon as the waiver was issued. As soon as there was the green light, there was a little bit of difference in how each state was going to interpret what CMS had said. Some states were initially saying, oh no, you can't use this just yet. We have to put our stamp of approval on it, or they had a different interpretation than what CMS had written in black and white. So as soon as we had all of those things ironed out, we started hiring folks and putting them through that temporary 8-hour curriculum, and then followed that up with a much more in-depth on-the-job training program. We didn't necessarily realize right away what it was going to look like anything else. When you don't have anything to compare this to, you're kind of drawing your own map. And one of the things that we saw early on was it allowed us to modify our recruiting strategies. When you're not having to look for that active certification right away, I know in our human resources department, it's not uncommon to receive 20 applications for a caregiver position for a certified nursing assistant. But of that 20, it's very common that only 1 or 2 of those individuals would actually hold the certification. They wanted to care for people, but they didn't hold that certification, and we didn't have a program in place prior to this waiver. So this allowed us to really open up the blue ocean to look for solid caregiver behavioral traits, empathy, compassion, those traits that make a good caregiver that weren't able to work in these types of positions before. And then competency program, we had to really develop something that was going to look at the skills and take the things that we typically grade somebody on after they've worked through their initial on-the-job training component, and grade them out to determine if they're competent in washing their hands, if they're competent in transferring somebody and operating a Hoyer lift, all of those different skills. We had to take what would be 6+ weeks of a CNA course, depending on the place that you would have taken the traditional course prior to the 1135 waiver, and jam that into the 8-hour course plus the on-the-job training components. There's a lot of things that need to be covered in order to set somebody up for success, but this waiver gave the opportunity to streamline these items. Next slide, please. So some of the initial hurdles, and this was really fascinating. This was almost like a sociological experiment to a degree, because we weren't sure how this was going to be accepted by our residents. We weren't sure how this was going to be accepted by the staff. We kind of were of the thought process that folks would be happy to have the additional help. We're very fortunate that very few of our facilities use a lot of agency or contract staff, but even amongst the facilities that we have that have 0 agency staff, we thought they'll be really happy they're not going to have to work all this additional overtime. One of the most eye-popping realizations we came to were that these individuals were kind of rejected from what I consider the wolf pack. That department was the wolf pack, and this lead dog was not necessarily somebody that they wanted to accept. They thought that since they weren't tenured and they hadn't truly been through the course, they weren't necessarily received initially as being on the same level as the tenured CNAs. So that was something that was really surprising to us, and we didn't initially have anything in place to mitigate that factor. Another big one was not what I signed up for. And I probably should have quote unquoted that, because we heard that initially from the first few people that came in, and they said, I really feel like I could care for people, but they don't really know what taking care of people is like until they're taking care of people. That talk versus take is a major difference. That was also kind of eye-opening for us. And then lastly, the steeper learning curve. And this is something that we should have probably had a better grasp on because of that bullet point that we talked about on the previous slide, that we were packing so much information into such a shorter period of time that to assume that anybody can really climb that curve that quickly was going to be a major challenge. So we had to find ways to make it bite-sized pieces so that they wouldn't get discouraged during their initial foray into caring for individuals. Next slide, please. So some of the steps that we took to knock over those hurdles. We had to bring our teams together, and we had to have really candid discussions with them of, hey, don't you guys remember where you started? I think that oftentimes when people are in the stressful situation of caring for individuals, or if they've been working 40, 50, 60 hours in a week, you can forget where you started because stress has taken over. And to be able to remind those folks, hey, take them under your wing. Don't eat the young. I think it's very common with folks that are in those caregiver positions. It doesn't matter if it's a nurse, if it's a CNA. Honestly, it doesn't matter if it's a housekeeper or an administrator. Anyone that just doesn't truly give that time, effort, and energy to those new people aren't setting them up for success. So we had to tell them, hey, you got to be welcoming. You can't be so skeptical. You can't assume that they're going to be gone after lunchtime. You got to welcome them, or else you're going to be living here at the facility. And we told them, you're going to be supportive and you're not going to be carnivores. We are not going to eat the young. Let's do everything we can to set these individuals up for success. The next thing we had to do was more on the administrative side. We had to really reframe the way that we interviewed folks. It wasn't just based off of, you have that certification, okay, you can do this skill, and this skill. We had to take it and really turn it into something behavioral, where we were creating difficult scenarios and asking how the person has in the past or would react in the situation. If they were coming from a completely different industry, or if this was their first job, we wanted them to tell us about a time that they learned a new skill, or a time that they were in something, a new type of situation, and how they felt and how they reacted and what would have made it better for them. And asking them how in the past they've dealt with a tough customer or a teacher. Everybody knows that the individuals we're caring for are sick folks and they need our help, or else they wouldn't be in the facilities that we are helping to operate. So asking how they dealt with a tough customer to make sure that they'd be able to bounce back from that and be resilient and understand how to interact with individuals. Next slide, please. So we wanted to ramp up our on-the-job training program. We went from, in the past, having a week of on-the-job orientation after everybody signed their pre-employment papers. We moved that. We wanted people to tell us, hey, I'm comfortable with this. So if it was an extra 2 weeks or 3 weeks even, we wanted to make sure that they were comfortable in their role. We wanted to make sure that only Orchards-approved CNAs were filling those trainer roles. If you put somebody with a toxic individual, then generally speaking, they are going to observe and utilize those same toxic traits. So we want to make sure that only people that were truly being positive and supportive were in a position to influence those individuals. Making sure they understood that these individuals were new to the industry and they were going to need a little bit extra help because they're not as familiar with the terminology and lingo. And adding something like time management to the skill competencies. Time management is something that it isn't really recognized until somebody has 8 to 12 to 15 people on their assignment, and it's, hey, you got to get all these tasks done. So making sure that they understand how to manage their time was another eye-opening experience for us. Next slide, please. So success to date, we've been really thrilled and successful that after the initial growing pains, that we've been able to retain 75% of these. So right now, I want to say in one of our facilities, we have 6 of these individuals working. So we're really thrilled to have that many working at one time, and across our other facilities, we've been able to retain a total of 75% of these. like I said, it's opened up a blue ocean for us recruiting, because these are individuals that couldn't have been here before that are ready, willing, and able to care for individuals. And we often talk about access. You hear in our industry providers talk about not having enough physicians or therapists. You don't often hear about certified nursing assistants. To be able to care for those individuals is, truly an access issue if they don't have someone there. So this waiver has been a terrific opportunity to create additional access for Medicare and Medicaid beneficiaries. And then proof of concept here. We've had no to limited negative staff outcomes, because obviously you wish you could save every single employee, but as far as the actual caregiving outcomes, we've had no negative outcomes, and really thrilled and proud of that fact, using these non-certified staff that didn't get to go through that formal education process. Next slide, please. So in review, I think it's been positive for our industry and overall economy. More opportunities for those folks that are interested in healthcare, given the additional opportunities for care to residents and people in need of personal care services. And I think this is truly a case study where regulatory relief has led to positive outcomes. Tips I can give when developing your program: modify your interviewing techniques to include those questions that are going to identify the right behaviors versus looking for somebody that just technically checks the boxes. Set clear expectations with your teams to ensure that these new employees are getting extra tender, loving care. Don't eat the young. And lastly, add time management as one of the major technical skills to those lists of employee competencies. Next slide. Thank you. And with that, I'm going to hand it back to Lisa for the Q&A.
Hi, thank you, Matt. Actually, this is Angel, and I will go ahead and pick it up from here. So now it's time for our speakers to take questions from the audience. Please join in and participate by utilizing the Q&A box located at the bottom center of your screen, or by raising your hand for the opportunity to pose a verbal question to our team. So I'd like to take a second to ask Zaheen if there are any hands raised for verbal questions. Zaheen, please let us know.
At this point, I do not see any hands raised. Just a reminder. Oh, yep, I see one hand raised. Just one second. And it's coming from the line of Diane Blake. And I will unmute her line. Diane? Diane, you may unmute your line and ask your question.
Okay. Can you hear me?
Yep, you sound great.
Oh, good. I just was curious with Matt, how many applicants did you have to go through to finally narrow down your 6 employees who are now working under the waiver?
So that's a great question. Initially, we did have I would say our first 3 or 4 really did wash out very quickly. But since that point, we've had an additional 10 plus applications in that one particular facility that had applied. And of that, we still have 6 of them. It would have been 6 of 9 in that one. Mm-hmm. So I'll go ahead.
I was going to say, and did you give them a special title, job description, focus for those that were working under the waiver, or did you blend them in as a CNA so that they would not be separate from the group?
We did blend them in initially, and I think that was one of the things that I wish that prior to bringing that very first one on, we had mentioned to the CNA staff, hey, we're going to be bringing in some folks that don't hold the certification, but we didn't truly explain what that was going to look like. Mm-hmm. Now, we have called them, caregivers in training in one of the facilities, but we have called them nursing assistants in the other. And then once they had completed the orientation process, we called them certified nursing assistants.
Okay, great.
Okay, I've got another question that's come in for Matt. Matt, the question is, what competencies did you use for evaluating the new trainees?
I'd be happy to actually share. I don't know if I could send a copy. If I get your email address, I'd be happy to send you a copy of what we've used. And obviously it can be built upon, but what we went through everything from soup to nuts as far as, you know, making sure that folks understood how to enter the room, how they were washing their hands, performing hand hygiene for themselves and the resident, transferring folks, lifting, toileting, and then all the way down to time management and documentation.
Great. We have another question for you, Matt. Did you assign one CNA to the trainee for the entire training period, or did you use multiple staff?
We initially had just sent them with employee A on their assignment for that day. But once we found that we weren't necessarily getting the same outcomes depending on who was training them, we took one or two certified nursing assistants per shift and made sure that they understood, hey, you're going to be responsible for setting this individual up for success. And then it really took off. That was when we started to see some serious success with it. So we have 1 to 2 per shift that these individuals can go with. And initially, for the first couple weeks, we just mirror their schedule with the trainer. We try to do it for the entire month.
Great, thank you so much. I am just going to check back in with Daheen to see if we have any other questions, any raised hands, any questions that folks would like to ask verbally.
Hi, I do see we have one raised hand. 1 second. And it is coming from the line of Robin Grant. Robin, you may unmute your line and speak.
Okay, can you hear me?
Yep, you sound great.
Great. So this is another question from Matt. How would you incentivize the temporary nurse aides that you have to go on to become fully certified CNAs, like once the pandemic is over?
That's a great question. I know this differs a little state to state. I know, I'm not sure where you are, but I know in the state of Pennsylvania, there's legislation that is about to be voted on in the House to allow these folks that have worked during the public health emergency to be grandfathered in. So our plan, if the individuals, if they're working in a state that doesn't pass any legislation, I'm still kind of hoping federally CMS or our legislature will pass something that allows all of these individuals that have worked during the public health emergency to be grandfathered in. But in the event that they do not, our intention is to sponsor these folks to go through the actual course. I'm guessing, and I say I'm guessing, but it truly depends on your state that you're in. What I have heard from individuals is that in the states that we operate, that at most, you're most likely looking at individuals having to take a competency evaluation. So the actual test part for anybody that's been working during the public health emergency. But we want to find a way to keep those individuals because they've been working, they've been successful. They truly are a case study in and of themselves of success, the ones that have stuck.
Great, thank you. I think a lot of states are going to be looking at how to move forward with that.
I totally agree.
Thank you, Matt. I've got another question in the queue from Angie Barr. She asks, are you seeking to certify these individuals so that you can keep them beyond the state of emergency?
Yes, absolutely. A lot, and like I said, a lot depends on what each state says as far as whether they're going to recognize those folks as full-fledged certified nursing assistants when the state of emergency is over. But in the event that they don't, then we're going to do everything we can to partner either with a local community college to ensure that these individuals get an opportunity to test if they have to, or if they would have to sit through the course to get priority in those classes. We partner with a couple community colleges, and in the markets we serve.
Thank you. This other question is for Matt. Did RNs and LPNs get involved in the training?
Not as much as, you always want more involvement. That's one of those areas where I think if you can create that sense of community, then there's a better chance that these individuals will succeed, really, regardless of the position. But if there was a technical question, I mean, there are very few individuals that in a nursing facility that, can do this personal care task. You typically have your certified nursing assistants, and then you have your LPNs and RNs. If it's a housekeeper, they're not somebody that's trained to be able to do some of those personal care tasks. So I would have loved to have had more involvement from them, but it was a very superficial involvement to this point.
Thank you, Matt. I think we have time for one more question. And this question is from the Q&A. Are you paying your non-certified nursing assistants at a lower wage? We are just wondering what other people are doing.
We have done that. I can say that we, like many facilities, we pay folks based off of, experience. And those individuals that were coming in without the certification were entry level. However, I can say we also operate an assisted living facility and an independent living facility, and folks that provide personal care tasks in either of those settings are not making as much as somebody that is coming in and working as a temporary CNA during the public health emergency.
All right, thank you so much, Matt. Next slide, please. So thank you again for your participation in today's call. We hope you found some value in the topics discussed. Please take a moment to complete the survey from today's event, and we will use this information that you provide to improve our events for future topic selection. And thank you again so much to our presenters today. This has really been a great topic. Thank you so much. Have a good day.